in to Radio Port One with me. This is Caroline Bosman bringing you the latest local news, gossip and interviews. In the studio with me today is local boy made good, successful London architect, Danny Steele. Danny, thanks for coming in.
It's a pleasure, Caroline.
Can I just say, it's been super having you back in Port Wen.
Well, it's lovely to be back.
We can't persuade you to stay for good.
Well, if anyone could, Caroline, you could.
Tosser.
No, but I'm in the running for a couple of juicy projects in London.
Shame. Still, we are so lucky to have you on the show for National Home Improvement Week. Well done. So, could you
Morning.
tell our listeners
Can we have the radio off, please?
I mean, how did you become an architect?
Is this the right form for a new NHS card?
What?
New patient.
We're not open.
I didn't have an appointment, so I thought I ought to come early.
Very interested to hear about it.
It's the
Right.
Royal Institute of
I'll see you now.
Right, great. All sounds very impressive. Lots of exams and things, I would imagine, pretty tough.
Turn that up.
Yes.
Well done.
Coffee is so not
It all
good for you.
sounds very exciting. And being in London. But you've still got your family down here in Cornwall, haven't you? Your mum?
Is she slurring?
Past Boscastle.
Oh, lovely.
Caroline, is Jude Law fit?
Anyway.
What?
Location.
Yeah, she
Have you
was
thought of
slurring.
doing any home improvements
Sorry,
there?
should I
Yes,
come
I'm on
back
a
in
sort of
another
break
time?
Anyway, so I'm giving you
No,
a place
it's fine.
to live a
Come through.
So, you're sexing up the family home at the moment, are you?
Yes, Mum's old place. I'm not sure about sexing up, but it's not much more than a lick of paint, really.
Yeah, Lou, won't be a tea.
And obviously, Caroline, when you're selling a house, it's good to view it from the point of view of the buyer. Try not to make bold statements. Keep to neutral colours.
It's a BMI of 21.5.
Is that good?
It's within recommended guidelines, yes.
Great. So,
Just a few questions. Have you or any members of your close family ever suffered from the following conditions? Diabetes?
no,
Heart disease?
no,
Arthritis?
no. No, look, doctor, I came here to register, and...
That's what we're doing.
I mean, I've been to the library and I got a card in 5 minutes.
Well, congratulations. If you get smallpox, I'm sure a good book will be a great comfort to you. Any history of fitting or dizziness?
No.
Chest pain, indigestion or breathlessness?
I know. Poor bloke. Having to put up with that boozed up old trout flirting with him on live radio. It's disgusting. She must be 40. She's a day.
That's it.
Thank you.
Makes you want to throw.
Pauline,
Yeah.
you done my list for this morning?
Yeah.
Can I have it, please? Now?
Call you back.
Thank you.
Hello, Mr. Kirk. You okay, my love?
I came early. Hope you don't mind.
Oh, God.
Sorry, love. I'm sorry, Doc. I know I smell. People keep saying. I can smell it myself sometimes.
Come through, please. Could you open your mouth?
Are you quite sure, Doctor?
Oh, I don't think it's the breath, but I'll just take a swab of your mouth.
I'm sorry, Doc. That's why I came early. Didn't want anyone to have to wait with me.
No, that's fine. Mr. Cook, Odour aside, there's no indication of ill health. There's no infection of the tonsils, which could be a factor. No gum disease, no atrophic rhinitis. I've taken the samples, and we'll see what comes back.
Thank you, Doc.
In the meantime, I'd like to go back to basics.
What does that mean?
Well, let's let me make some calls and see. I'd like you to come back this afternoon, and I'll sort you out something then.
Nothing's been the same since I've been on my own, Doc.
All right, your wife's died, has she?
Wife? No. I mean, since Freddie went.
Who's Freddie?
My greenfinch. Flew away weeks back. I loved that bird. He could sing that song. How'd it go? Pum, pa, pum, 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 pum.
No idea. Sorry.
Pum, 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 pum.
No, I can't help you.
Freddie knew it perfect.
Hi there.
Hello.
Waiting for the bus? Of course you are. Are you on holiday or?
No, I've just moved here, actually.
Really? That's great. I mean, good. I'm PC Milo, Mark, by the way, the village police officer.
Yeah.
Right. Yes. Okay. Well, be sure to come and search me out if I can. And welcome to Port One.
Thanks.
Bye then.
Bye.
Hello again. Sorry, it's just that there aren't any more buses today.
Make sure you take it half an hour before food.
And you reckon these will work, do you?
No, I just prescribed them for fun. Ah, Caroline. I'm glad you dropped in. You spare a moment?
No, it's fine. I'm sure Pauline can sort me out a prescription.
Come through, please.
Sorry, no time to chat. I'm not properly parked. I only need some medication for a recurrent condition. I don't see the need to bother you. I usually get over the counter, but Mrs. Tishel...
Mrs. Tishel quite rightly thought that a recurrent condition should be investigated by your physician. What's the medication?
Oh, was it, is it fluconazole?
Thrush.
I mean, it's only the third time, the fourth at most. I mean, she's such a busybody.
Why don't you go and park your car?
I haven't got time.
Well, I believe I have a couple of cancellations this afternoon.
I've said I don't have time today. I mean, can't you just fix me the bloody prescription?
A, I'm not in the habit of just fixing prescriptions, bloody or otherwise, and B, I'd like to see you. Now, if you really can't make it this afternoon, then make it tomorrow.
Seems I'm to have an appointment tomorrow.
Well, it seems I'll have to make one for you then. I got a 2 o'clock or a 2:30.
I'll take the 2 o'clock.
Not exactly difficult to find, are you? The car looks like it's been parked by a bloody 12-year-old. It's blocking the road.
I was only planning to be here for 30 seconds.
I have been sitting at our meeting like a right sodding plonker.
Do you mind? This is a doctor's surgery.
Tom, let's just go inside. Time of the place.
Oh, I don't know whether it's a drink or what it is. You're just not you anymore.
Tom, of course I'm me. I just...
I packed a few things. I'll let you know where I am.
Tom? Tom!
This is totally brilliant.
This is not brilliant.
I wouldn't park there, love, if I were you.
Really? Well, if I were you, I wouldn't come out in daylight, love.
Mark, can I have a word?
All right, Doc. I wanted to ask your professional opinion. Feldenkrais.
No, I haven't got time.
Rediscover your innate capacity for graceful, efficient movement.
Mark.
Hi.
Hi. Hello, Doctor.
Hello. Could we?
Yes, of course. Nothing urgent, I hope.
Oh, no. It's just that you said if I needed anything, and actually, I was wondering if you know a good driving instructor.
Mark, I need to speak to you.
Yes, right. If you take a seat, I'll be with you in 5 minutes. 4 minutes. Wow. What do you think to her? I think today might be the day to see if my special spray does what it says on the tin. Pheromones.
Mark, I think Caroline Bosman has a drink problem and is continuing to drive.
I see.
Now, I'm hoping to see her tomorrow, but what worries me is that she's a risk to herself and other people.
Right, I'll look into it. Does this smell of anything to you? I can't smell anything.
What do you mean you'll look into it?
I need evidence, obviously. I have to have reasonable cause to suspect. That's the Road Traffic Act. You might be an aggrieved neighbour, someone with an axe to grind.
I'm her doctor.
I take drinking and driving very seriously, of course. Is she single, do you know?
Mark, you are a police officer. It is my professional opinion that a member of this community is a potential danger to herself and others. I expect you to act appropriately.
Sorry to keep you waiting. I'm Mark.
I'm Julie Mitchell.
Hi, Julie. Great name.
So, driving instructors? I should have thought they say when you live in the country, you have got to drive.
Yes, okay, let me see. Well, there's Andrew Clark. He used to be quite good. Mind, he might have retired or if his eyesight got a bit... No, you'd probably have to go to Delabole, unless you had someone local, you know, informal. Hey, listen, don't suppose just a mad idea. You wouldn't consider if it was just informal. Sorry, I don't know where that came from. That just came... Oh, out of the...
No. Why not? Okay.
Okay. Really?
Yeah. Why not? Thanks.
It's not because you're pretty. I mean...
I've already said yes.
Social services? No.
Well, they'll give you a bath.
I can bath myself.
But they'll give you a bath and they'll launder your clothes and your sheets and your towels and they'll give your house a good clean.
I'm not having charity, no.
It's not charity. Mr. Cook, as I explained, I can find nothing obviously wrong with you for the moment. So it makes sense to see if this improves things before we try anything more invasive. Mr. Cook, as your doctor...
Doctor? What do you know? You're frightened at the sight of blood.
I know you stink to high heaven.
Is it really that bad?
Social services are here.
All right then, Doc, you win. Let's give it a try.
Yeah.
Excuse me, Doc. So how's life as a radio star, then?
Did you hear it?
Yeah.
It's a real penance. I can't believe I've agreed to do a whole week of it. Obviously, I've reached the pinnacle of my career.
Well, I didn't realise it was a career move.
Well, career move in Port Wen? I don't think so.
There you go.
Thanks.
Thanks, Mike.
And that one.
Oh, thank you.
Louisa, sorry, I didn't mean... I mean, obviously, your job, I mean, that's fantastic. I mean, you've done brilliantly. I wasn't talking about you.
All right, Doc. Oh, that's right. And foot on the clutch. And away we go.
Look, what I meant was, and I don't want to sound arrogant, but Here I am, a career architect on community radio, talking about the merits of sash bloody windows. Do you know Caroline actually left me on my own while we're on air to go to the loo?
So what does that mean?
Oh, come on, everybody knows. And I'm sorry, but her breath as well. It was-
Right. Just put the box down there, will you? And I'll sort them out tomorrow.
I'm just saying she needs some
Yeah.
help.
Bye, Danny.
And slip her into third. Well done. She likes you. You all right?
Yeah,
Well done.
thanks. Who was that?
Don't worry. I'm onto it.
Out, 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 out!
Hi.
Hi.
Oh, hello.
I wouldn't.
So, how
How's
are
your
you?
new job? You first.
Yeah, great. But it's hard, you know. Sometimes I feel like a fraud somehow, like the governors will suddenly realise the huge mistake they've made and that I am, in fact, completely incompetent. But I expect everyone feels like that, don't they? I mean, not you, obviously, because, well, you're a proper professional. That's why I'm here, actually. Could I ask you for some professional advice?
Of course.
Yeah. Well, the thing is, there's this friend of mine. I think she might be drinking too much, and she's having a hard time at the moment, you know.
Right.
And she's asked me to meet her later for a drink, and I'd just appreciate some help with, well, how to tackle it.
Well, don't meet her for a drink, for starters.
Yeah, fair point. But say, technically speaking, how many units are too much?
Does it matter? You obviously think it's too much, or you wouldn't be here.
Martin, I'm asking you to give me a hand here. My friend needs help, and I don't know what to do.
Well, if your friend is the person I think she is, judging by my dealings with her, then I don't think she wants any help.
No, I know, but doesn't that depend on how you give it?
Well, I don't know. How do you give it? If I give people advice, they seem to want a prescription, or if I give them a prescription, then they want advice.
Well, surely there are no fixed rules. You just have to feel your way and listen to your patients, I guess.
All right. That hadn't occurred to me.
Martin,
What?
what am I doing wrong? Whenever I try and connect with you, you just close down. And then I start doubting myself when maybe it's you who should have the doubt, and maybe then you'd be more approachable and people would want to listen to your advice. And apart from it helping you in your job,
Well, if you're so conversant with the finer points of my job, then you won't need my advice on what to say to your alcoholic friend Caroline when you meet her for drinks.
This one's got a great view. I want it to be special, you see. It's a surprise.
It's very romantic, especially at sunset.
Not too obvious.
No!
Maybe this one, bit less. What if she gets chilly? And if we can move one of the patio heaters? No, I think this one. This is the one.
Fine. This table, 7:30 tomorrow night for 2. Hi, Louisa.
Hi there.
Look at you.
Can I have a bottle of sparkling mineral water? Make that a large one with 2 glasses, please. Oh, thanks, Jade.
Thank you. Hey. I am so glad to see you.
Had a bad day.
The world's going mad around me, I'm telling you.
Is it? See, the thing is, Caroline...
Oh, have you ordered the wine yet? I could kill for some cold Chablis.
Well, no, I'm not drinking tonight. Are you on a diet or something? You're looking very, sleeping okay?
I don't need a medical, Louisa. I'm seeing a doctor tomorrow. I just need a couple of glasses of white wine.
Well, I just thought people seem to drink so much at the moment, don't you think? Thanks. So perhaps we could just give it a miss.
What do you mean, everyone?
I'm just concerned.
Well, I'm just concerned, actually. Because if you'd bothered to ask me, I'd have told you that Tom has just left me and I am just feeling completely crap.
Caroline, I'm sorry, I had no idea.
So we could have drunk that bottle of wine together, because that is what old friends do, actually. And maybe, just maybe...
Okay then, as an old friend, I thought, hearing you on the radio today, that you didn't sound yourself and that you sounded a bit shaky.
So you just wanted to pat me on the back and tell me to sober up like everyone else.
No, Caroline, come on.
Well, thanks, but no thanks. Go and do your pastoral care on 9-year-olds. Tom?
It's me, Mark.
Oh, Mark. What do you want? I'm asleep.
Sorry to wake you. I just wanted to have a little chat. It's quite important.
What is it?
I just wanted to mention it's a good idea to be a bit careful about having one too many. Best to stick to fruit juice when you're driving is my advice.
Not you as well.
You nearly ran me off the road today, and I've received comments in my professional capacity.
What comments? I mean, who from?
I'm not at liberty to divulge my sources.
Oh, just bugger off!
Caroline!
Port Wend's very own architect extraordinaire. Welcome back, Danny.
Thank you, Caroline.
And our first caller is Bert.
Be a lovely boy, that Danny, didn't he?
If you want the job doing well, you want to get in the professionals. Large and Son provide free quotations for any job.
Thank you, Bert. I wonder, did you have a question, Bert?
Yes, I did, as it happens. My question is for you, actually, Caroline. What time are you driving home today? Not being funny, I just wanted to make sure I'm not going to be on the road when you are.
Oh, dear.
Mrs. Tishel. There you are. Off you go. I understand you had a patient of mine in yesterday and you refused to give her some fluconazole.
Oh, Doctor, I'm sorry. Oh, dear, it's the 5th time she's had it, and I know you don't like it.
Absolutely, and you should not give her fluconazole without a prescription.
I don't need to apologise.
No, and feel free to refer her back to me if she's not happy. I'll review the situation when I've seen her.
Oh, Doctor, wouldn't now be a good time to look at those journals together? I can make a nice cup of tea and a pasty.
No, I have surgery. Good morning.
Homemade?
Caroline? You okay?
I'm fine. Just leave me, would you?
Come on, it's okay. Everyone knows Bert just spouts hot air. Lots of hot air, so you don't notice you've got no hot water.
That's not true, actually. He did get hot water through once. In a Bruce Hampton's downstairs toilet bowl.
Here we go. They're all in the bar, by the way. It's Stella's 21st. Hey, happy birthday.
Thank you. Yeah, good. You're kind.
Oh, Caroline. Thank you very much.
Cheers, Stella.
Thank you. Thank you very much.
Have a good one.
Cheers. Not gonna help the room, is it?
Come in. Caroline, take a seat.
Please, can I have a prescription? I've got thrush. It's a pretty common condition, I understand.
That's right, but it's not common to succumb to it quite as frequently as you apparently do.
2 or 3 times?
Mrs. Tishel said it was 5 times in the last 23 weeks.
Isn't that breaking patient confidentiality?
I mean, I would be within my rights to go and get Conazole elsewhere, you know.
Yes, you would. Tell me, are you washing the affected area with soap and water?
Beg your pardon.
It's best if you don't use soap.
I'll bear that in mind.
Do you have any other symptoms? I don't know if you're aware, but your speech is quite often slurred.
I think I know what my voice sounds like. I work on the radio.
I'd like to look in your mouth.
What?
Candida albicans, the fungus associated with thrush, also lives in the mouth. Sit down, please. Open. You've been drinking.
That's what you wanted to know.
First, I'll deal with the thrush, and then I'll deal with the alcohol.
The alcohol? No, I don't drink any more than anybody else.
Do you ever find yourself drinking first thing in the morning to steady your nerves or get over a hangover?
No, I mean, certainly not.
Do you often find yourself getting annoyed with people who observe or criticize your drinking?
That's it. I've had enough. Who the hell do you think you are asking inappropriate questions about something I have not even consulted you about?
So that's a yes, then, is it?
I heard a patient choice, Doctor. I am just about to exercise it.
You're such a people person, aren't you?
Next.
Oh, God!
Caroline.
I know. Mark, look. I'm just not with it in the moment.
Caroline, I'm sorry about this. Due to the manner of your driving, I suspect you may have been drinking.
Mark. This is me, Caroline.
We have to do this properly. Please switch off your ignition and step out of the vehicle.
God's sake, Mark. I haven't been drinking. I mean, I've had exactly one glass of champagne. I mean, what's the matter with everyone?
When did you last have an alcoholic drink?
I don't know. A couple of hours ago.
Right, I now require you to do a breath test, and failure to supply is an offence for which you can be arrested.
No, I can't believe you're doing this, Mark.
And I'll show you the breathalyzer I intend to use and how it works. This is the tube that you blow into.
Oh, just give it here. You've got to be joking.
Hi. Look, I'm sorry about yesterday. Peace offering.
Come in.
Martin will be here in a minute.
Oh, well. Then everything will be lovely.
Can I get you anything?
Water. Cold?
I don't know if I should give you any water. It might affect the blood test.
Then what would you like to get me, Mark?
Thank God you're here. She wanted some water, but I thought I can't give her water.
Right. Caroline,
Dr. Ellinger?
you all right?
Is that some sort of joke?
Do you know why I'm here?
For God's sake.
I need to take a blood sample on behalf of the police.
Get on with it.
Give me your arm. Your decorating mark smelled varnish.
I noticed that. I don't know, I thought it might be nail varnish, but it could be my new aftershave, Doc, the one I was telling you about.
All right, hold up. Get a glass of water now. Caroline, you're not well. I'd like to do some more tests while I'm here.
You're not my doctor anymore.
Nevertheless, I strongly advise that you let me examine you.
You know what? You can keep your strong advice. I want to go home now. Mark?
I can arrange for your vehicle to be towed, but
No, I want to go home now, please.
I can't leave the station at the moment, I'm afraid. I've got somebody coming in at an appointment.
All right, I'll take her.
No, thanks. I'd rather walk. Oh.
This is the room we had to sit in when we had that detention. You remember?
When we all got sent to the headmaster after we bundled what's-his-name into that wheelie bin.
And then that thing on the lid so he couldn't get out. God forgive us. Do you give detentions?
No, not really. Well, I sort of try not to.
I only did that thing to Martin because he kissed you.
Did what? Has he said something?
Who?
Martin. You just said, didn't you just say?
Martin Farry in the wheelie bin.
Oh, that Martin.
So that's why you've been so cool with me.
Well, I've hardly been cool. And anyway, nothing ever actually happened. It was nothing.
Really?
No, really. Honestly, it was moments. And not even that, it was, you know, a moment.
Where are you going?
Vernon's on his way back.
Oh.
According to the Care Bears, he's just as bad.
Well, you can't just leave.
I'm going to get an aromatherapy burner and some oils.
Good idea. Ellingham?
Ellingham, how's it going in, where is it?
Port Wen, thanks for getting back to me.
What can I do for you?
An old man, late 70s, with quite frankly the worst smell I've ever come across in my life.
Well, if you don't know, I don't know. You're the great diagnostician. Anything else in the history?
No, I'll check for all the obvious URI infections.
Send in a SWAT team and scrub him down.
No, that didn't work. He's possibly a bit depressed. His greenfinch is missing.
So what's the smell? Ammonia? Ammonia with depression. I guess liver.
No.
Pear drops. Smell of pear drops.
Pauline, I need you to call the Police Forensic Science Service and tell them I want a glucose test on Caroline Bosman's sample. Urgently.
You've got patients backing up.
Well, send the next one through. But make that call.
Mr. Addo, you can go through.
Those tablets you gave me are rubbish. I'm still coughing up the Yangtze River.
Well, you've only just started taking them. They're antibiotics. You're meant to finish the course.
Oh, sure. I read the newspaper. Don't you think I know what drug companies do? Yeah? Paying you to test out their drugs on people like me. Bunging you computers, free lunches.
Just finish taking the medication I prescribed you. Ellingham? Yes. Bosman. Glucose. Oh, that was quick. How high? Shut up. No, not you. Patient. Are you sure? All right, I'll get right onto it. Thanks for letting me know. Pauline? Right, Mr. Addo, I'm happy to say I'm going to cut short our consultation. Go home, take the tablets, drink plenty of fluids, and lap up the contents of your moronic newspaper. Pauline, I've got an emergency home visit.
Hello? You got patients?
I'll reschedule it, but before you do that, call Mrs. Tischel and ask her to prepare me a 10-milliliter ampule of soluble insulin. Tell her I'll be there in 4 minutes.
I left her a message at the radio saying I'd call in.
She's gone out somewhere.
Yeah, maybe you're right.
Probably down the pub.
It was pretty rubbish last night. Maybe she's avoiding me. Martin?
Where is she?
Well, she's not here, Mike. What's the matter?
She must be. I dropped her here not more than an hour ago myself. She was in no fit state to go anywhere. Tried the bag?
Yeah, it's locked.
Caroline! We'll have to break in.
Must have been over the top, isn't it?
Caroline? Caroline?
God, Caroline.
It's Dr. Ellingham.
What, can I do something?
Yeah. Call an ambulance. Tell them it's suspected ketoacidosis. I'm about to give her 10 milliliters of insulin subcutaneously.
Right, okay.
Insulin? But she's not diabetic, is she?
Now, please.
Yeah.
Ambulance, please.
All right, Caroline.
Dairy Lane.
Gonna give you an injection.
I'm saying a prayer for you, Caroline.
Just a little prick.
The doctor's here, and he says it's a ketoacidosis. Yeah, and he's giving her an injection. Insulin, 10 milliliters.
Hi.
Hi.
I don't know if you got my message. I thought I should talk to you in person.
Message?
About the driving school in Delabole?
Oh, the message.
It just seems, you know, a place on their intensive course at short notice. It's just too good an opportunity to pass up.
Of course.
And it makes sense just to blitz it, get my license, and get on with it, don't you think?
Yeah, too good an opportunity. Yeah, go for it.
So, I'll see you around. Bye.
Mm-hmm. Mark, you have a problem.
You're right there, Doc.
Your breathalyzer, how old is it?
What? I don't know, since before my time, I think.
Some of the older breathalyzers picked up ketones in people with diabetes. Gave a false positive recording. You know that smell of nail varnish? That's ketones. That's what your device was registering, not alcohol. Caroline's blood sugar level measured so high that she nearly died. So if you want my advice, I'd get rid of your old breathalyzer and find something new that works.
Yeah. What does work, Doc? What does work?
No, I don't know any of the newer models. And, well done, that call. Caroline's test probably saved her life. I'm sure she'll be very grateful.
Hello, it's PC Milo here. Yeah, fine. I made a reservation for a table for 2 for tonight. Yeah, I'd like to cancel it, please. Thank you.
I told you I was clean.
Right, come through, would you? Mr. Cook.
I'm sorry, Doc.
No, Mr. Cook, not your fault.
Those 2 old ducks were as good as gold, bless them, but could do nothing. Mind you, my toe's got a good clipping.
I'm going to send you to the hospital in Truro. They're going to want to keep you in for a while, just to monitor what's going on.
Bye, dog. Bye, Mr. Kirk.
Not so fast, Pauline. I'd like you to call Truro Hospital and see if you can find a bed for Mr. Cook and book in those tests. Thank you. I'll look for your patient notes.
Oh, God, stupid thing.
Got some matches here somewhere, Pauline. There we are. There.
No,
Oh, God! They must be in here somewhere.
Mr. Cook. Mr. Cook. Sorry, do you mind if I have a look at what's in your bag?
Oh. Freddie?
Doc, Tom Bosman, Caroline's husband.
Oh, yes, I remember.
Yeah, I'm sorry about that. I was out of order.
How is she?
Alive, thanks to you. Louisa called me and told me what happened. Thank you.
Good.
Anyway, she's in their bed 4. Still bloody minded. There's no cure for that, I suppose.
No, I'm afraid there isn't.
No, you're the wrong person to ask anyway, aren't you?
Mr. Bosman?
No, sorry, it was a joke.
Yeah. Are you currently on any medication?
No.
Any birthmarks, tattoos, distinguishing marks?
No. Yes. If you count this.
Last night, all 7 celebrities were safe.
Not anymore. Somebody else leaves the jungle tonight.
Who will it be? Find out next.
I'm a Celebrities coming up.